My name is Imad Absah. I'm a pediatric gastroenterologist at Rochester, Minnesota at the Mayo Clinic. I'll be talking to you today about the mucosal healing, or the rate of mucosal healing in children with celiac disease who are already treated with gluten-free diet. There is no specific test or non-invasive test to assess the true healing rate. More recent report looking at the antibodies found that negative endomysial antibody is the most predictive antibody or blood test to assess the true rate of healing and resolution of the mucosal injury. The rate of healing in children has been always presumed historically to be complete within 6 months or 12 months on gluten-free diet, based on old data when people used to use what's called Crosby capsules to get a small bowel biopsy. Recent adult GI or adult studies found that the rate of healing is slow and invariable, maybe only 66% after 5 years healed their gut, and there has been no recent data in children. Because of that, we looked at our own records between 1997 and 2013. We identified all the children with celiac disease, and we looked into the ones that had a repeat biopsy. We found 40 children out of 222, which is about 18%, had a small bowel biopsy repeated. Now the downside that this is a retrospective, and also it is small sample size, and almost all the children who had repeat biopsy had symptoms. So it wasn't a true follow-up biopsy, but it was an indirect way of assessing the rate of healing. Most of these kids had abdominal pain. The second complaint was diarrhea, and the third one was constipation, and there was few patients with other symptoms like dysphagia. The biopsies were reviewed by one pathologist, and the time frame between the first and the second biopsy was 24 months average. We found that only 64% of these children had complete healing. 23% has mild inflammation with only lymphocyte but no villus atrophy, and the rest had persistent injury. Again, as I said, most of these patients had symptoms, but when we reviewed the biopsies, we found there was no good correlation between the symptom persistence and also the villus atrophy. So there was 20 patients with abdominal pain, only 2 had persistent injury of the gut, and 7 patients with diarrhea, and only 1 had persistent injury. So in conclusion, in the selected group of patients with treated celiac disease, only 64% had complete healing. If you add the ones that had only lymphocyte but no villus atrophy, that would be about 85%, so 15% had persistent injury, and there was poor correlation between the symptom persistence and mucosal injury. Thank you.